Hello, I'm Nik Blosser, Governor Brown's Chief of Staff. Several weeks ago, we presented the Governor's high-level framework for a step-by-step reopening of business and public life in the state. Today, we are presenting specific details on the next phase of reopening Oregon. As a reminder, we are not in control of the timeline. The virus controls the timeline, and we have to be able to adapt to the situation on a regular basis. The governor's goals for reopening business in the state are as follows. First, minimize hospitalizations and deaths. We know that we're likely to see more positive cases, but we really want to minimize severe cases that lead to hospitalizations and deaths. Second, we want to allow people to safely return to work so they can support themselves and their families. Third, we want to minimize risk to frontline workers. Fourth, avoid overwhelming healthcare and hospital systems. Fifth, protect those at highest risk of severe illness, especially communities of color. And sixth, support for small local gatherings that preserve community cohesion and cultural practices. Please understand, we will be living with the virus until there is a reliable treatment or prevention like a vaccine, which is many months off. The primary tools we have are pretty low tech: physical distancing and increased hygiene. Every restriction we lift increases transmission of the virus and will likely lead to an increase in cases, so we have to be careful. There are a number of actions we will need to keep up and keep doing. These include vulnerable populations must still stay at home. We must have little, if any, visitation to nursing homes and hospitals, limited gatherings and travel, increased hygiene, and of course, staying home when you're sick. Last week, the governor also announced some updated further actions around testing and contact tracing, and today she's announcing new policy regarding wearing face coverings when in public. These will be very important to protect us as we begin to lift restrictions. The statewide face covering policy being announced today is as follows. Employees in certain businesses where distancing cannot be maintained are required to wear a mask that covers the nose and mouth, including at grocery stores, pharmacies, public transit, salons, and in ride-sharing services. In addition, we strongly recommend that businesses where employees are required to wear these face coverings establish a mandatory face covering policy for their customers as well. And finally, we strongly recommend that a mask or cloth material that covers the nose and mouth be worn in any indoor public space, especially where 6 feet of physical distance cannot be maintained. Okay, let's talk about how we're going to lift restrictions now in phases, starting with some updates to our current state and then going into detail on phase 1 and subsequent phases. We're making some updates to the current restrictions statewide. On May 1st, the governor already lifted some restrictions on non-emergency procedures and visits to doctor and dental offices. And on May 5th, we issued guidance that lifted additional restrictions on outdoor recreation. Today, the governor is announcing 2 other updates. First, some clarifications to treatment of certain retail businesses. In short, furniture stores and boutiques that were closed can reopen on May 15th statewide if they follow the general guidelines for retailers. And second, we're lifting some restrictions on childcare and on summer education programs for youth, including summer school camps and youth programs. There will still be limitations and specific guidelines to follow, but we're lifting the outright prohibition on these activities statewide effective May 15th. To lift further restrictions beyond that, the governor previously announced that she wanted to let certain regions and counties of the state move more quickly, but she also wanted to be clear on the set of prerequisites for doing so. So I'm going to summarize real briefly what those prerequisites are. There are 7 of them. I'll summarize them here. Number 1, declining prevalence of COVID as measured by either hospitalizations or emergency department visits. Second, a minimum amount of testing in the county or region. Third, a robust tracing system to follow up with contacts, and you can see the specifics there listed on your screen. Fourth, we must be able to isolate or quarantine folks who test positive. Fifth, we have to finalize the statewide guidelines for things like restaurants and personal care. And 6 and 7 really have to do with having sufficient hospital capacity and sufficient personal protective equipment in those hospitals, including a 30-day supply for most hospitals or a 14-day supply for small and rural hospitals. Here's a summary of the prerequisites. You can see some of them are by county, some of them are by health region, and some of them are statewide. If a county believes that they meet these prerequisites, they will submit an application to the governor's office starting this Friday, May 8th, with a goal of reviewing those quickly and allowing some counties to enter phase 1 as soon as next Friday, May 15th. Here's a map now of the regions. Now let's talk about what is actually in phase 1. On this table, you can see in the middle column the modifications that we're making statewide that I previously mentioned regarding childcare, summer youth and education programs, and outdoor public spaces. And then on the right-hand column, you can see the 4 sectors where restrictions will be lifted in phase 1. These are restaurants and bars, personal care, including salons, barber shops, massage therapy, gyms, and local gatherings. The new local gathering maximum limit will be 25. For each of these 4 areas, there are detailed guidance documents produced by the Oregon Health Authority that aim to allow businesses in these sectors to open and operate in a way that keeps both their employees and their customers safe. Here's an example of some sector-specific guidelines. I won't read these in detail, but you can see how detailed they are. For example, in restaurants, we have to ensure tables are spaced at least 6 feet apart, and that means including when customers approach or leave tables. And you can read the other details here. As we reopen, we all need to be crystal clear on this. We could have another and even bigger wave of COVID, and we will be monitoring outbreaks closely. On your screen are the 3 metrics we will be looking at across the state and for each county. First, are we able to reliably reach the contacts of 95% of positive cases quickly, within 24 hours? And are we able to trace the majority of these new positive cases to existing cases? So as an example, if we have 10 new cases in a rural county, it's very different if those cases all come from one known source versus if they came from unknown places throughout the community, which would indicate the virus is gaining increasingly widespread. So contact tracing is really important in helping make this work fast and efficiently. Second, if the positive cases of COVID rise too quickly, or third, if the severe cases of COVID, as measured by increased hospitalizations, increase over a 7-day period, we will have concerns. Now, I also want to say nothing is automatic, but if any of these metrics are violated, excuse me, we will have an immediate meeting with local public health to assess the situation and evaluate what potential actions to take. After 21 days in phase 1, counties continuing to meet the prerequisites may be able to enter phase 2. The specifics of what is in phase 2 still need to be finalized, but they will include allowing some return to offices, expanding the gathering size, and beginning to allow visitation to congregate care facilities. And then there's phase 3. We consider phase 3 as the phase that includes much larger gatherings, including concerts, conventions, festivals, and live audience sports. We will not be able to enter phase 3 until a reliable treatment or prevention, like a vaccine for COVID-19, is available, and it's unknown right now when that will be. So as a result, all large gatherings should be canceled through at least September. We will be monitoring things closely and will issue guidance later this summer for large gatherings that want to take place later in the year. Now, if you can reduce or modify your gathering to be able to accommodate these much more restrictive conditions, then you can consider that. But large events really should cancel at least through September. And finally, here's a summary of the phases in Oregon. You can see them listed here, and thank you very much.